Hello and welcome to Health Tips with me, Patricia Roxanne Hammond. Today, my guest is Dr. Promise Sepoga. He's a consultant obstetrician gynecologist with Shape Healthcare at Latibiokoshi. Dr. Promise Sepoga is my guest today, and today we're discussing vagina discharge. Yes, it's very important.
Yeah.
So tell us about vagina discharge.
Good. So thanks for having me today. Vaginal discharge is a normal thing in every woman, provided it is clear to colorless or just a bit cloudy.
Okay.
It does not have any abnormal smell. It doesn't itch, and then it doesn't come so much to wet your underpants. So that discharge, which fits this description, is normal.
Okay.
And every woman has that.
Is it like should it be like a daily thing? Like every day there should be
Yeah, it's almost there daily, but then at certain parts of the menstrual cycle, it gets a bit more. Say about the time of ovulation, and then just before the menstrual flow, then it's likely to get a bit more. But once it is clear or just cloudy, once it doesn't itch, it doesn't have any color, it doesn't have any abnormal smell, it doesn't irritate, it's not so much to wet your underpants and make you uncomfortable, it is normal.
But during ovulation, it's something, it tends to wet your pants.
Yeah.
Because of the continuous discharge. Why is it
Yes, so that is a natural thing that the mouth of the womb, we call the cervix, produces for the purpose of helping the sperm to swim up into the womb to fertilize the egg. So around that time of your cycle, it's normal that you see a bit more of the discharge, and it's typically a bit more stretchy and light, but that's just perfectly normal.
Okay.
Sometimes it may come with a bit of pain in the lower abdomen on one side or the other.
Is it possible for another person to smell my discharge?
If it's a normal discharge, probably not.
Smell, but I'll just smell it.
You may just know your own body smell. That's all.
Okay.
So if the discharge is abnormal, it means the discharge is plenty enough to wet your underpants. That is not normal. Yes.
Okay.
If it
Even
has,
though it's clear.
I mean,
Can
if
the
it's
clear be abnormal?
occasionally, but then it will not just be plenty. It would come with an abnormal smell,
Okay.
rather than your normal body smell, right? It's likely to come with some irritation, either itching or burning,
Okay.
and then it's likely to have an abnormal smell, plus the fact that the color. So if the discharge is anything other than clear or just cloudy, if it's yellowish, blue, purple, anything else apart from clear to just a bit cloudy, that is not normal.
Does the infection, if we get an infection, does it also determine the color? From
Yes.
yellow to brown
Yeah.
to blue, purple. I don't know. I haven't seen blue and purple before.
Yeah, neither have I. Yes, so certain types of vaginal infections will cause the discharge. So the commonest we see is what we call candida infection,
Okay.
which is a yeast infection. So the vagina has a way of keeping itself clean, and it ensures that by the presence of certain organisms there, okay? There are different types of organisms. Some produce some acid. So naturally, the nature of the vagina is supposed to be acidic, and that's how it protects itself. And so if there is a disruption of that acid level, then the infection is able to grow. Okay? And the commonest is what we call the candida, or the yeast infection. Okay? And that typically comes from the organism called candida. There are various subtypes of candida. So then the discharge will either be whitish or creamish. It may look like yogurt,
Okay.
or curdled milk, or what they describe as cottage cheese, cheesy, okay? And then that also comes with itching. And the itching may either be in the vagina or the outside, okay? Occasionally, your sexual partner may also pick that and complain of itching.
Okay.
So that is one of the common vaginal discharges, which is abnormal due to candida infection. So it's called vulvovaginal candidiasis.
Vulvovaginal candidiasis.
Exactly. Then It could also be due to a bacterial infection. And there are a whole host of bacteria that can cause vaginal infection. But the thing about the bacterial infections, they produce a discharge which is very offensive. Okay? The candida, the smell is almost fishy. Fishy. But the bacterial ones can be really pungent, like rotten egg, or the smell of a choked gutter, all sorts of very unpleasant smell.
Yeah.
They come from the bacterial infection. And that discharge typically may be yellowish, or occasionally, if it's so bad, it may be bordering on light greenish. Right.
And that is also capable of wetting your pants.
Oh, yes, that will be copious, offensive, and then they may come with some irritation.
How terrible is vaginal discharge?
So the thing about vaginal discharge is, to the woman, you're unable to tell what it is. You can't tell this is an infection, that this is a normal thing, or you cannot downplay it, because it has a tendency, if it's left untreated, from the vagina, the infection can spread up through the cervix, which is the mouth of the womb, and go through the womb, and then gets into the woman's tubes. And the tubes are very precious. Once the tubes are damaged, the future ability to conceive becomes compromised.
That's serious.
Yes. That's how serious abnormal vaginal discharges are, which is why we're talking about it today.
Okay.
Because once you have the discharge and you're not sure, you are better off getting checked in a hospital.
When should I see my doctor? Or anytime I feel I have an infection, I can just go to the pharmacy and then tell them and then get any, or maybe what others do is you go for checkup the first time, maybe the doctor prescribes a particular antibiotic.
Yeah.
So the next time, is it right to be repeating the same antibiotics?
No, unfortunately, that's not right, because what causes the infection one time may not be the same thing another time.
Okay.
You know, like I said, you can have so many different bacteria causing an infection. So if you think I took this medication the last time and it worked and you went for the same thing, it may not work. You are not able to tell exactly what the cause is. Because one of the things we do when you come to hospital, we are likely to take a little bit of the discharge and send it to the lab, look under the microscope to see what type of bacteria is this.
Okay.
Which specific antibiotic or medication is it going to be sensitive to? That's what we do. And so if you don't know, you're just taking it blindly. You risk abusing the antibiotics so that next time you need that antibiotics for some severe infection may not work for you. Plus, you may not be able to treat this thing effectively, and you risk the complications of untreated vaginal discharge, including future infertility.
Terrible. You know, there is this, I think, commercial out there. If you have candidiasis or any kind of vaginal infection, take this herbal medication or take this vaginal wash. Is it right? Should we always come and see the doctor?
I mean,
or we can go herbal when it comes to vaginal discharge?
Unfortunately, see, fair enough, most of the author's medications may be from plant sources, but then they have been researched and processed, and then we have quantified the dosage. So if you could just grab some herbs and mash it or boil it or whatever, and you're either drinking or inserting, what dose is that are you taking? And then you don't know what else that is going to cost to you. We've had scenarios where people went inserting herbal preparation in the vagina. Unfortunately, the vagina got so inflamed, it got so sore, it healed and got stuck together. Yes, from herbal medication. And who wants to go through that? That requires surgery to try and create a new vagina. And every now and again, you have to come for us to dilate it so that it keeps patent. Otherwise, it's stuck. Okay, so put no herbs in the vagina if you value your vagina.
Put no herbs in your vagina if you value your vagina. What of the vaginal wash that has been advertised there?
So the vagina has its own way of cleansing itself. Okay, so from the top, the old cells just get off by its own secretions. So the vagina can do without your interference. At most, just splash your clear water there, particularly if you're in the time of your menses.
You have to wash it.
Clear water. If at any point we think you need some, there are very few medically recommended ones, then we would then recommend that for you. But on your own, you're probably going to do more harm than good.
For this commercial out there, I think something has to be done because it's been advertised. You know, there's one that's anytime you insert to wash the place, they claim it makes it tighter and it makes it smell good for your partner during sexual intercourse.
Yeah. I mean, these are all marketing gimmicks.
But it's not right.
So that is why we are talking this, so that we can educate you. So your vagina has a way of cleaning itself. There's no real need to put anything there. It just disrupts the acid level in the vagina and puts you at risk of some bad infection. And sometimes it distorts it permanently. And so you keep getting the infection, the discharge on and off just because you have really kind of messed it up. So you are safer staying off these things, except we see some necessary and we recommend for you.
So I want to ask, is it possible that I can go a whole day without discharge?
Of course, it's possible.
And I have no problem?
Yes.
Like I'm okay?
Yeah, you're okay. It's also possible that you can have some little bit of discharge. Once it does not have any smell, does not make you uncomfortable, it does not itch or burn, you're fine.
How do we get this infection? Is it always through sexual intercourse?
Not necessarily. Sometimes the woman can pick it from the toilet seat. Okay. Occasionally, when you take antibiotics for whatever reason, then the antibiotics likely to disrupt some of the normal bacteria in the vagina. As that happens, another group of organisms there would overmultiply. That will lead to a vaginal infection and a discharge. Sometimes when you take a lot of sweet, sugary stuff, right, it affects the level of acid in the vagina. And once the acid level goes down, you are likely to come down with the vaginal candidiasis.
Okay.
And that tends to happen a lot in people with diabetes who have not got very good control.
Okay.
As a matter of fact, for some people who get recurrent vaginal itching and discharge, you say, you know, why is this coming so much very often? Let's check your blood sugars, and you see that you should have diabetes without knowing.
So before we go, I want to find out. So you talked about the intake of too much sweets. Does it happen to children as well? Or let me just to chip this second one in. At what age does the vaginal discharge?
Say from puberty.
Okay, so even if it's a child and you're introducing a lot of sweets,
it's not a healthy thing to start with, because it damages their teeth.
Okay.
It makes them develop a lot of fat cells in waiting. Then when they become adults, those fat cells grow bigger, and then adult obesity sets in because you've set it up for them when they were children.
Okay. Thank you very much. And my guest has been Dr. Promise Sepoga on health tips. With me, Patricia Roxanne Hammond. Dr. Promise Sepoga is a consultant obstetrician, gynecologist with Sheep Healthcare at Latebiokoshi. If you have any problem with your vagina, please visit Dr. Sepoga. He is available with his team to assist you. Until then, stay blessed.